Okay, so we're doing a series of what we call snippets. We're doing a series of 5 to 10 minute presentations on peripheral neuropathy. Those of you who are not familiar with the fact that there is more to peripheral neuropathy than diabetes or maybe a pinched nerve in your neck or your low back, or maybe a pinched nerve in your ankle called tarsal tunnel syndrome, or post-chemotherapy. There are approximately 80 other different types, and Dr. Gates and myself are kind of going through them almost one at a time, or several groups at a time, to try to put a little something online for everyone who has each individual type of peripheral neuropathy, and have some sort of a resource to get some feel for it. I'm Dr. Martin Rutherford. I am a chiropractor, 35 years, who has done a significant amount of postgraduate work in functional medicine. This is Dr.
Randall Gates. I am a chiropractor as well as a board-certified chiropractic neurologist.
And between those three disciplines, we've been able to meld those disciplines into a understanding of what creates chronic pain, frankly. And we have developed a practice that treats a lot of chronic pain, fibromyalgia, peripheral neuropathy, chronic fatigue, and just a number of other different chronic pain issues, neurological issues. Peripheral neuropathy has morphed into one of our biggest patient populations. We are currently co-authoring, or whatever you want, collaborating on a book on peripheral neuropathy, and we're in the last, I think maybe the last edit of it right now. And so we're trying to share with the public what we think is correct data. And so this snippet, if you will, is going to be on femoral peripheral neuropathy.
Yes.
And in as much as Dr. Gates's, I can't say specialty, what can I say?
Passion.
Dr. Gates's passion. No, in our world, in our paradigm, Dr. Gates is conversant in the brain and nervous system, the peripheral nervous system particularly. He's had the opportunity to even develop some, as he puts it, novel or new treatment paradigms for this, which are proving consistently successful. So I'm going to defer to him on this subject and let him kind of school you on femoral neuropathy, what it is, and any other nuances that you feel are important that someone who has it might like to know.
Okay. So the femoral nerve is a peripheral nerve, meaning it's a nerve that comes out of it's away from our spinal cord. So our central nervous system is our brain and our spinal cord. Peripheral nerves lots of times come out of these nerves from our spine, and then they accumulate into one nerve and go to a certain location. The femoral nerve comes from the nerves of our lower back, and basically it innervates the thigh muscles that allow you to stand up as well as to straighten out your knee. It also innervates some of the skin involved in sensation on the front of your thigh, as well as down what we term the anteromedial and posteromedial calf, called the saphenous nerve. Maybe a little too specific, but if you're watching this, you're probably wondering about that. So peripheral neuropathy is a very interesting subject, just because we have an entire website now coming up.
That's right.
And we're continually bringing our videos to it, called www.peripheralneuropathygroup.com. And there we talk about peripheral neuropathy ad nauseum. Peripheral neuropathy in the lay lexicon, so how it's commonly used in our language, refers to when people start to get numbness and tingling in their feet, can spread up to their knees, and then can also involve their hands. Things like diabetes cause peripheral neuropathy, but there can really be about 80 to 100 other causes aside from diabetes. However, there are these things called mononeuropathies. Femoral neuropathy is one of them, meaning a single nerve that is a peripheral nerve is involved. Now, with femoral neuropathy, it's common to happen after hip surgeries. It can happen when we have things like masses growing on our kidneys, masses growing on one of the muscles that raises the thigh up or the leg up, called the iliopsoas, hematomas. It can happen after other surgeries in the abdomen. And basically, if someone starts to develop numbness and tingling in the front part of the thigh, weakness of those muscles, atrophy of those muscles, it can signify a medical condition that needs appropriate attention, like immediately. pretty quickly, because if you don't get to it, that nerve, the femoral nerve, may start to die and be dead before it's recoverable. So that's why femoral neuropathy is really an important condition. If you've had a hip surgery, if you've had an abdominal surgery, and all of a sudden you have numbness and tingling in this distribution, you need to go back to your surgeon and let them know immediately, basically. And femoral neuropathy isn't something we commonly deal with just because we deal with the other forms of peripheral neuropathy. But those are the diagnostic possibilities that one has to be aware of.
Yeah, those are conditions. That area is a condition that has to be differentially diagnosed properly, because there are other things that can cause that particular pain. So don't freak out if you go, oh my God, I have this. But
you can have a low back problem.
You can have a low back problem. I mean, you can have a foot that's pronated in that's affecting your hip, and then that's affecting that area. But under the circumstances that Dr. Gates just outlined with post-surgical types of conditions, hip and kidneys, and then his advice on getting to your doctor immediately should be heeded.
Yes, absolutely. And know that also diabetes can cause a condition that mimics femoral neuropathy, but really it's a little more complicated than that. My uncle had that. It was very interesting. And so
Uncle
he developed...
Al?
No, this is not Uncle Al. This is
Uncle.
Uncle Steve.
Okay.
But hi, Uncle Steve. But basically, he had it where he started getting these sensations that I described, and then his thigh muscle got weak, and he didn't have any reflexes at his knee. And it's really due to his diabetes damaging the nerve plexus that comes out of the lower back.
Okay.
Yeah.
And that's about it.
That's about all we need to say.
Really, that's
femoral
really all we need
neuropathy.
to say.
Yeah.
Yeah.
Okay. Well, thank
Not
you.
common for those of you though who needed to hear that. There it is.
And so, if you have any other questions on neuropathy, go to www.powerhealthtalk.com, or you can go to our neuropathygroup.com website. It's actually peripheralneuropathygroup.com. I'm getting signals from our producer. Or you can go to our Facebook page, Power Health. All right. Thank you for watching.
Yeah.